to another episode of StudyMEDIC podcast. Myself Midun, and today we are going to discuss about the most practical and career-changing clinical training program of StudyMEDIC. So we have Dr. Sowmya here, who's co-founder and who has mentored thousands of doctors to achieve their career dreams. Welcome, ma'am.
Thank you, Midun. Thank you so much. And I'm really glad that we are picking up the topic which is most trending and which is the need of an hour. So I'm happy that we are doing the podcast on this.
Yes. In a nutshell, could you please explain what is Advanced Clinical Training Program?
Actually, the clinical training program, basically we are there globally. And as you know, we have got a lot of student base who are not only in the OBG, non-OBG courses and all sorts of skill set courses. So the demand started coming in when people are not able to get their dream specialty. So they are getting the eligibility, they are able to join the colleges. Sometimes they are not getting the college of their choice or the specialty of their choice. So that is when people started asking, can we get a clinical program where they are able to learn the clinical skills and with hand-holding of the academics, and they are able to finish the Royal College programs. The basic thing is, all Royal College programs need certain number of years of experience, and that experience we want to enrich them with the clinical skills and with tracking system, so we know where do they stand, plus hand-holding of them from day one for mentorship, so that they are able to clear their exams and they are able to become a best evidence-based clinicians. So, and for this, what we did was we tied up with almost like top tier hospitals in metros, in tier 2 cities, in tier 3 cities, in tier 1, because we wanted to make sure that they have the comfort to work from their home, at the same time get their specialty of choice and get their dream job done. So that was the whole intention of creating this.
Yes, that's wonderful. So this all started from the demand from the students who wanted to have a clinical exposure in real life scenarios. We started as an online education platform. Now we are here with tie-ups with most of the hospitals, hospital chains in India. So if I'm a student who want to enroll into a top medical institution, say like whether in Bangalore or in Hyderabad or in Delhi, like Father Muller or St. John's or Max or Medicover. So we have all these beautiful institutions with us where I could train like with the real patients and so on and so forth, and I will also get. So what should I do to get into this program? So how can I enroll in this?
Yes. So what we did first and foremost is to have a proper assessment of the candidates coming in. Because see, if for example, if you want to do a radiology, at least you need to have a minimum basic exposure there. So, and also to be assessed whether you are scalable or whether you can upgrade yourself. So the process is very simple. Once I get in touch with the StudyMEDIC team, we are going to have a look into their CVs, their certificates and their registrations, the State Medical Council registrations. Then they are going to have a proper online interview process where they are assessed on their professionalism, their passion, their motivation for the goals and their undergrad scores. So starting from MBBS to till now what additional qualifications they have done, we have very structured objective marking system for them. Plus, towards the end of the interview, they have to attend a mock as well for their respective specialty. So overall, they need to get around 70% of the mark to be eligible for the next round of interview. So once they are selected with the primary screening, secondary screening happens in the hospital what they have chosen at. And also we need to make sure that the hospital also has got a particular time the vacancies. So once we coordinate with all that with the hospitals, then they have a second round where the clinical lead would be talking to them and the HR would brief them the protocols. And once there is a technical round they finish, then they are onboarded. So the process is quite systematic. And I would say mostly it is objectively assessed. So we are also giving them a fair chance to go through the process because we have a huge demand. So we are supposed to be filtering the candidates who are eligible, who are capable of doing this. And also we are providing the best of the best candidates to the hospital so that the patient care wouldn't be compromised. So that's the whole process what we do.
So it's a win-win situation in any part for the hospitals, for the students.
Yes, exactly.
Everyone gets what the most benefits. It's not guaranteed. So each hospitals might be having limited number of seats.
Exactly.
So you have to clear the process. And we will streamline it, right?
Correct.
Okay. Right. So what happens after this suppose I have entered the clinical training program in a hospital. Okay, so what can I expect from there?
Okay.
Whether I could go on wards, whether there will be, what will the experience that I get. So
yeah. So the clinical programs, they are actually special because you are actually going through for example, if you're a student, you have an academics every day where you are handheld by StudyMEDIC mentors. You are supposed to be reading things, you are supposed to be attending the mocks. So that happens on the other side. But for the clinical, from the day one, there will be an induction where you are oriented of what to be done. And we do give them a rotational chart, like you would be going ahead through all the subspecialties in the time frame. Some of them where we see that the exposure to be more, so they would have for 2 to 3 months. Somewhere it is less, it could be lesser speciality which is of importance. You could go from 15 days to 1 month. So we have a rotation chart which is very specific. So there is an educational supervisor in each of the hospital who take care of these rotations. So you are exposed to all sorts of cases from simple to complex, from outpatient to inpatient to, based on the surgical specialty, if it is their theatre or if it is a OBG labor room, and all those things would be covered as well. And also, it's very essential what we realize that we need to track their progress. So that is when the e-portfolio came into the picture, where you are doing your daily logs, whichever the patients you see you are going to enter, and you are assessed from formative and summative assessments, which are actually done by your clinical heads. Okay, so and also we have a minimum number of things to be done in first 4 months, what to be done, next 6 months, what to be done. There is a clear plan, pathway for these students to go through. Okay, so and also they have reviews frequently from educational supervisor, and also if there are any concerns, the educational supervisor would raise, and if the students have any concerns, they can raise to the educational supervisor and to us also. Generally, it is a smooth, hassle-free system where you know that whatever you do, you are being monitored and you are working under the able clinicians. So you are able to observe and assist and make sure that you are learning the techniques of dealing the patients. Right? Let it be communication, let it be handling probably the documentation which is important, or probably ethical part of it, or also the skill set like the procedures. So you are covered wholly there, and you also know that when there are no assessments, you are going to be little relaxed, but when there are assessments, you are supposed to be knowing that I need to be learning this. So indirectly we are pushing them to learn better. And at the same time, they have, just like any other doctor in the hospital, they have a weekly offs, they get that relaxation time as well. And also the academics, we are pushing them nearing the exams, because it is not only the clinical training, they have to finish their respective Royal College programs. So we would be pushing them with the academics also. So they are going to go hand in hand, the academics and the clinical work. And also the mentors. Mentors in the clinical side, they have educational supervisor, there is a clinical HOD, and they have a clinical director who will be able to take care of them. And here for the academics, we have StudyMEDIC mentors who are able to help them on a daily basis. So you have this e-portfolio, the advantage is you have an objective assessment. Even if you apply for a job outside, you could show them what you have done. So that makes their life very easy.
Yes, coming back to the e-portfolio. So most of the clinical programs, they only give ARP or like periodic review and some of the features of assessment. So as you said, this e-portfolio is as per the NHS UK standard.
Exactly.
This is exactly what they follow.
Yeah.
So we have adopted that e-portfolio. And also we'll be having something like a double mentorship.
Yes, exactly.
Like MRCEM, if we talk about MRCEM, Dr. Sri Krishna is very well-renowned doctor in emergency medicine.
Exactly.
And you will be trained under him.
Yeah.
As well as you will be trained under the doctors in.
Exactly. Exactly. Because the advantage of keeping them in these top tier hospitals is you have a lot of consultants who have been examiners for these Royal College memberships. They are well-known figures in the place where they are working, and they have got a lot of patient inputs. So all those things we are considering and making sure that the academics and the clinicals are held hand by hand.
So that comes to my next point. So that is why we are giving 100% success guarantee, right?
Yeah, so, exactly. So success guarantee is something, it's actually difficult to say that we'll make sure that everybody will pass. Okay, but what we make sure is to give them the best what they can learn, and we push them to do that. It is not that we only give and forget. They are supposed to be doing everything, single thing, and we are tracking them. For academics, they are tracked through attendance. The customer care keeps actually contacting them to understand where they go. And for these clinical candidates, they are very special in a way because they have trusted us with their clinical exposure. So there is an expert mentorship. They have one-on-one sessions. They have a separate orientations. So they have extra session from mentors which they feel it difficult. So we are giving them that premium touch because they believe in us to become the best version of themselves. And success guarantee, we can guarantee because of the hospitals what we have got, and also the academics which has proven by itself that we will be able to make sure that the students clear their respective exams.
No one else will be able to do that because we got the infrastructure, we got
exactly,
the mentors,
exactly
everything we got. That is why we are.
Yeah, that is why we can confidently say yes, we will be able to provide.
If you don't clear at one time, then we will make sure that you pass it next time.
Exactly.
Yeah, that is. So we are hearing also about the placement guarantee, right?
Yeah.
So what happens if I clear this? Then what can I do after that?
See, placement guarantee also came through the demand, to be very honest. And placement guarantees, it's not only in UK. Yeah, they would want to do it in abroad, anywhere, like probably GCC countries. So what we would do them is we try to understand, because from the interview process, there is a question which asks, where do you want to see yourself after 5 years? By then only they come with a feeling of whether they want to work in India or abroad or UK or GCC. So once they finish their registrations, like they have done all the 3 parts, for example, MSUG, we would help them to take their OETs and GMC registration. Okay, so once the registration is done, because we have got a lot of partnership with the different hospitals and different agencies, we would be able to place them comfortably in the place of their choice. And of course, we try that maximum, so that at least if they want to work in UK, so we would be able to give them that help, hand-holding help, so that of course how they perform an interview and all, it depends on them, but we would train them for that as well. So majority of them get placed. Yeah.
So it's a comprehensive career changing moment, this clinical training
exactly
program. So you are coming to us as an MBBS graduate with an internship.
Correct.
And you are not sure about what to do next. Then we'll guide them, we'll make sure that what is their preferred stream. Then we'll place them in a top hospital, super specialty hospitals, and we'll make sure that they pass in the Success Royal College exams, and we'll also make sure that they get the job that they deserve, right?
Correct.
Then it's a comprehensive path. So what about while working, we'll also be providing them with a stipend, right? So how is the stipend
See, it all depends on the place they choose, and obviously if they are working in metros, the pay scale would be different, just like any doctor working in metros or in a tier 1 or tier 2. The advantage is that they are working and they are earning also. So it is not that because like once you finish your MBBS, you are expected to take care of yourself and your expenses, and to a certain extent the families as well. So I think that is why we came up with a thing, only coming and paying again for another 2 to 3 years and without any financial freedom would be difficult. So that's the reason the stipend thing came into the picture. And most of the students, we have got many students who have done this, and they are quite happy with the whole of the process because they are supported holistically, including a bit of a financial freedom they have got. So that's something. And also, like, we are partnered with a lot of banks as well, where they provide the EMIs as well. So if at all, if somebody wants to get in that, we can help them to get in touch with the bank, and they can do the process from there as well.
Okay. Very thanks for clearing that up, because most of the times what happens is that someone promises something, and it's, especially in financial cases, they will not be able to fulfill that promise. So that is something that the students will also have whether they are saying that you will get this much stipend or that much stipend, but they are not getting that. That is not the case here.
That is not the case here. So that we are very clear and transparent, that everything is on the paper, so they know what they are getting into from the day one.
Okay. So do you have any message to the clinical candidates who are unsure about their career? So what is the message that you could give them?
No, I would only say that if somebody is looking to work in their dream specialty with getting that, are enabling themselves with the clinical skills, including all the holistic approach to the patient, like communication, professionalism, ethics, and the most important nowadays, the legal documentations, And also meanwhile they would want to get a degree like a Royal College membership, and somebody who is not able to get through NEET PG, or they are not in a position to write the NEET PG, whatever those people, because we want to be there, we want to make them that they are the best version of themselves. So I think this is an ideal program to go through the clinical and academics, and they can at least whatever, because for us doctors, passion is something which we always work around. So I'm passionate about a certain field, it's always a good idea for me to run longer in that field. So for those people, I think advanced clinical program is the best bet to finish off a Royal College membership and to get all the skills, and then they can start on their own.
Thank you, ma'am. Thank you for your time. So let's wind this up. So this is India's leading clinical training program. And if you want to know more, if you are struggling as a doctor, if you are struggling as, if you are not unsure about what to do next, surely give it a try. Give us a call, and we'll make sure that you deserve the career. You will get the career that you deserve.
Exactly. They can just give a call and understand what, because there are always options open, so they can always get in touch and then probably take it.
It's not the end of the road for
exactly. It is never an end of the road. Yes.
So thank you, everyone.
Thank you.
Thank you for your time. Have a wonderful day.
Thank you.
Thank you, ma'am.
Thank you so much.